Certainly, I can provide you with information about HIV and AIDS. HIV, human immunodeficiency virus. HIV is a virus that attacks the immune system, specifically the CD4 cells, T cells, which help the body fight off infections. If left untreated, HIV can lead to the disease AIDS, acquired immunodeficiency syndrome. Transmission. HIV is transmitted through contact with certain body fluids, primarily blood, semen, vaginal fluids, rectal fluids, and breast milk, from a person who has HIV. Common modes of transmission include 1. Unprotected sexual contact with an infected person. 2. Sharing needles or syringes with someone who has HIV. 3. From mother to child during childbirth or breastfeeding. 4. Contact with contaminated blood, such as through transfusions, rare in regions with strict screening procedures. 5. From a contaminated needle stick or other sharp instrument, more relevant in healthcare settings. Signs and symptoms. Many people with HIV do not experience any symptoms in the early stages, but some may have flu-like symptoms within a few weeks of infection. These symptoms can include fever, fatigue, sore throat, swollen lymph nodes, and rash. These symptoms often subside on their own, and some people might not even notice them. Pathogenesis and progression. After the initial flu-like symptoms, HIV can enter a clinical latency stage, during which the virus continues to replicate at a lower level but causes little to no symptoms. Without treatment, this stage can last for many years. Over time, the immune system's ability to fight off infections gradually weakens as the virus continues to damage and destroy CD4 cells. As the CD4 cell count declines, the risk of opportunistic infections and certain cancers increases. This is when HIV infection progresses to AIDS. AIDS, acquired immunodeficiency syndrome. AIDS is the final stage of HIV infection, characterized by severely weakened immune function and a high susceptibility to opportunistic infections and certain cancers. A person is considered to have AIDS when their CD4 cell count falls below a certain threshold, or they develop specific AIDS-defining illnesses, such as certain types of pneumonia, tuberculosis, and certain cancers. Causes. HIV is caused by the human immunodeficiency virus. It is primarily transmitted through behaviors that involve contact with infected body fluids, as mentioned earlier. Prevention and treatment. Preventive measures include practicing safe sex, using sterile needles, getting tested and knowing your partner's status, and using pre-exposure prophylaxis, PrEP, for individuals at higher risk of HIV. There is no cure for HIV, but antiretroviral therapy, ART, can effectively control the virus's replication, maintain a healthy immune system, and,